My name is Dr. Raz Penmacha. The topic I will be talking about is glaucoma. What is glaucoma? Glaucoma is a disease of the optic nerve. The optic nerve is the structure that connects the eye to the brain. So when light rays enter your eye, it hits the retina, and the impulses that the retina receives is sent to the brain through a structure called the optic nerve. Now, if the optic nerve gets injured, it will result in vision loss and possibly blindness. And glaucoma is when the optic nerve gets damaged. Glaucoma is the #1 cause of blindness in African Americans and Hispanics. It is the #2 cause of blindness in the world. About 2.3 million Americans are diagnosed with glaucoma, and another 2 million don't even know they have it. Another word for glaucoma is the silent thief of sight. And the reason why it is called the silent thief of sight is that it takes away the vision so slowly that people learn to live with that vision and they don't even know anything is wrong. And another reason why people don't know they have glaucoma is that you need about 40% of the optic nerve to be dead before people will start suffering vision loss. So I could be having glaucoma, and if 30% of my optic nerve is dead, I still will be seeing perfect. So it's only when it's above 40% of the nerve that's dead, that's when we'll suffer vision loss. So if a person has vision loss from glaucoma, it's already at a bad state. So imagine this: if I put a jar of pennies, like 1,000 pennies in a jar, and I took out 1 penny every week, it would probably take you a little while to realize that some pennies are missing. But if I took it out all of a sudden, people would notice it. So glaucoma is a very slow progressive disease that people don't realize they have it until a lot is missing. People always ask me, what causes glaucoma? To this day, it is unclear as to the actual reason what causes glaucoma. There are theories. One is called the mechanical theory, and another is called the ischemic theory. The mechanical theory is that people feel that if pressure is elevated in the eye, it actually causes damage to the optic nerve. But some people we're finding are actually getting glaucoma even though their pressures are normal, and that is called normal pressure glaucoma. And that's why some people feel that it may be due to reduced blood flow to the optic nerve, kind of like heart disease. When people get lack of blood flow to their heart, it causes ischemia. That means there's less blood flow to the tissue. But what we do know is that if we lower eye pressure, it does stop glaucoma in some people, or bend the curve and slow it down. So if we treat glaucoma early, we can usually stop it. If we treat it late, we can sometimes stop it, or we can just bend the curve, but it progressively gets worse. So we want to catch it early. How do we diagnose glaucoma? We have a lot of tests that we have available to us and technology that can catch glaucoma very early, and in some instances before we can actually even see it. The first thing we always do is we always check eye pressure. Normal pressure is anything less than 21. If your pressures are above 21, that certainly is a strong risk factor for getting glaucoma. The second thing we do is we also check your side vision. We run you through a test called a visual field test. If it shows peripheral field loss, then that means you may have glaucoma. But like I said previously, a person can have glaucoma even though 30% of their optic nerve is dead. It's only when 40% of the optic nerve is dead that's when visual field loss will occur. So people sometimes, we make diagnoses and they say, hey, I don't have any visual field loss. How could I have glaucoma? It's because we caught it early. We also take color photos of the optic nerves. And that is a very important thing because optic nerves should always look the same size, shape, and color year after year after year. If we have a photo of the optic nerve and say a year from now the optic nerve changes color or size, shape, then we know that person is converting into glaucoma because of the shape change. We also have special technology called a nerve fiber layer analyzer. We all have a certain thickness to our retina, and the topmost layer of the retina is called a nerve fiber layer. Very few things can thin that nerve fiber layer. One is glaucoma and one is small strokes of the eyes. If the nerve fiber layer starts to thin, that is a strong sign that you may have glaucoma. So if we run people through these tests, we can usually catch glaucoma at a very early state, and sometimes before we can actually physically see it. Now, can glaucoma be treated? Absolutely. We have wonderful medicines, laser procedures, surgical procedures that can stop it or bend the curve and slow it down. If we catch glaucoma early, we can usually stop it. If we catch it late, we can sometimes stop it, but at the same time, it can still progress, so we always want to catch it early. The first thing we always do when we treat glaucoma is use eye drops. Eye drops are the safest first step. That's why we generally try to use medication first. And we have so many choices to choose from to tailor the glaucoma treatment based on how much pressure reduction we need. Or some patients have certain allergies to certain medications, so we have a lot of choices to pick from. The second thing, if drops are not working or they're not tolerated, we can use laser treatment. And the laser that we use is called the selective laser trabeculoplasty. It is an extremely safe procedure. In other countries, they commonly use selective laser trabeculoplasty, also known as SLT, as a first-line treatment. In this country, we traditionally start using medicines first, eye drops, and if that doesn't work or we need additional help lowering the pressure, then we use the laser called selective laser trabeculoplasty. It is a very, very safe procedure. There's no downtime. It only takes a few minutes to do, and there's no pain associated with it. And it can lower the eye pressure, and it can be repeated, the laser treatment. The most important thing about it, that procedure, is it's extremely safe. It has a very low risk profile. Now, if we tried medicines and it doesn't stop the glaucoma, and we tried laser and it doesn't stop the glaucoma, we have many surgical treatments available. One of the newer procedures is called the Glaukos eye stents. It has been recently FDA approved over the last few years, and it can be used during cataract surgery. It's a glaucoma surgery for mild to moderate glaucoma, and the nice part about this procedure is it doesn't add very much risk to just traditional cataract surgery. It is the smallest stent or implant in the world to this date that is implanted into the human body. And what it is we implant this little stent, kind of like how people have heart disease and they put a stent in their heart arteries to expand it. Well, we do the same thing in the eye, where we put a small stent in the structure of the eye that drains the eye to further enhance fluid flow out of the eye. And it is a very safe procedure. So if a person has cataract surgery, has a cataract and glaucoma, it is recommended to have the eye stent placed in at the same time the cataract surgery is done. This way, it can all be done at the same time, and the risks are not any greater than just doing the cataract surgery alone. If a person has severe glaucoma, we can do glaucoma surgeries called trabeculectomies or express mini shunts or tube shunt procedures. What these procedures do is we actually make a drain through the white of the eye, connecting from the inside of the eye to the outside of the eye, so the fluid can leave the eye appropriately and easier. All these methods can help reduce pressure in situations that are uncontrolled by other means. The eye stent procedure in particular is an extremely safe procedure which can lower eye pressure and which we did not have just a few years ago. The most important thing about glaucoma is to get your eyes examined. We don't want to catch it when it's at a severe stage, because these patients traditionally continue to decline even with treatment, but at least we can still slow it down to buy many years. At K-Fair Eye Associates, we stand ready to assist you with your visual needs. Thank you.